Hey everybody. Let me just verify this thing is on. It's my lunch break. Lunch break cancer talk. And gonna be quick. I don't know if it's gonna be a quick one or not. I'm pretty busy today. So I'm actually skipping lunch, but I'm doing this during my lunch kind of thing. So let me make sure this is all going. Which I don't know if it's live now or not. Is it? Trying to see if it's actually working right now. You know, you just never know with these things. So it is. All right, so we're live. So today's talk, I don't know. I was trying to think of how I can do this series of video talks. Not so much about my cancer directly, but again, it's like talking. Maybe we go through and we just find people that have been sharing their stories. Because you can go in there. I just typed in "I have cancer" and you can see a long list of just different people that have gone through cancer. Maybe we should go through and see where their first post is or what post we find, and then see what the current status is of them and see where they're at. I thought that would be interesting. Another one would be sharing, like Pee Wee Toms. He passed away. He actually shared his videos too a lot. Maybe because I don't want to do just my cancer. I think that's there's more people going through other forms of cancer and all that stuff too. So let's go with let's go with this one. Maybe she says something. Let's see. Let's have a story thing. 3 minutes.
I was surprised because in the condition that she's in, a person like that, usually they really don't want to interact with nobody. Like you're at the end of life.
Yeah, this stuff isn't supposed to be bad. It's just you're learning, right?
Can somebody help me fix my blanket?
I'm gonna do all. I'm gonna fix this up. You want this one? This one? This one has roses.
Oh wow. Well, it's the same cancer I have.
She was very clear. She was teaching about pancreatic cancer, death and dying, and pain.
We started doing research and looking up her disease and stuff like that and asking her questions. She was very talkative. I was happy that she was able to open her house and her life and her disease for us to learn about it.
It's like a cycle. Your life. You started going to school in Holyoke, and now you're teaching for Holyoke.
Yeah.
And all these people in your class and all the teachers that knew you, now they know you again.
As a teacher.
Pretty cool.
I know, this is so blowing my mind.
It's blowing your mind.
Yeah.
I think she actually wanted someone to talk about it with her.
I have 6 months to live, and I already passed that by.
A couple months. That's when you went to hospice, right?
Yeah. This is the second time that I've done this.
Your heart just hurts. It's like, what can we do? And that helplessness is very hard.
In school, they always teach us, like, pain management is the biggest thing. Like, we have to treat the pain. With her, like, how do you treat it? Like, you tried everything. What else is there to try,
Mother and child, holy infant, so tender and mild, sleep in heavenly peace, sleep in heavenly peace.
Well, was not. Okay. Let's find another one. We got here 4 minutes. All right, we'll do this.
Today's topic is 8 signs that you have cancer. 1. A lump beneath the skin that feels hard. Lumps in breast tissue are often first discovered by women, and yes, sometimes men, who perform self-exams and feel their breast tissue regularly. Touching your own body and getting to know its usual feeling is a good way to be able to distinguish when you have a change in the tissue.
Hi, welcome back to Dr. O'Donovan, Medicine Made Easy. In this video, which is part of the Potential Cancer Red Flag series, we're going to be covering warning signs and symptoms of potential pancreatic cancer. Pancreatic cancer is a cancer that's found anywhere in the pancreas, which is the organ in the top part.
So a quick thing before he gets into all this, I'll explain how I found my symptoms. So I guess it started with tiredness. That was kind of the initial one. I didn't think of it as a big deal. I used to drink here and there, probably a bit too much, and I stopped drinking, and I thought I was damaging my liver. So anyway, stopped drinking, all that stuff. I started losing weight, getting really tired, and then I had a dull pain right here in the side of my stomach, almost as if you're running. You go out for a long run, and that pain you'd get after during the run. Anyway, I had that. Went and started getting blood work because I just hadn't done it in a while. Most of that came back negative. Then I went and got more blood work. And anyway, the next thing happened was I went to take a dump. Number 2, right? And it came out white. I'd never seen that before or anything like that. And it was kind of like a shock factor because, it was like this white almost. Didn't know what was going on, kind of was looking stuff up, and I still was scheduling for blood work and whatnot. And then all of a sudden, I was turning yellow. It looked like I was getting a tan. My hands were turning yellow, my feet, right around where your feet, where I had socks. I was walking around without my socks. I was asking my mom, I was like, does it look like I'm turning yellow? And she's like, no, it looks like you got a tan. And I was like, no, to me it didn't look like it. When you wear socks, like I'm a white guy, I guess, and I thought it was. Anyway, so one day we were sitting at the table, or I went in the bathroom, looked in the mirror, and it looked like my eyes were yellow. And I went in to eat breakfast with my mom, and I took a picture. I had her next to me, somewhere over here. Anyway, I had a picture of her next to me and so on. And you can totally see the difference with my eyes and her eyes, how mine were yellow all the way around where the white is. And anyway, that's kind of when we really found out that, the jaundice set in, and then we went to the ER. I was waiting for one blood test to come back, and once that came back, then we went to the ER, and that's when they did a CT scan and found the cancer.
Part of your tummy, which helps you digest your food and makes hormones such as insulin. How serious pancreatic cancer is depends on where it is in the pancreas, how big it is, if it's spread, as well as your general health. Pancreatic cancer has affected famous people globally, and some of the well-known people who unfortunately passed away with it include Steve Jobs and Ruth Bader Ginsburg. So if you're a clinician, NICE guidelines suggest that there are 2 important things to watch out for in patients who might have potential pancreatic cancer. The first recommendation is that if your patient is 40 years of age or older with jaundice, they need to be referred urgently within 2 weeks for a direct assessment on a suspected cancer pathway. Remember, jaundice is caused by a buildup of bilirubin, which is a dark yellow-brown substance made in the liver. Normally, the liver releases a liquid called bile, which contains bilirubin. Bile goes through the common bile duct into the intestine, where it helps break down fats. It eventually leaves the body in the stool.
So the bile too, or bilirubin and so on. So that yellowness that you had in your, I had in my body, it was basically, that was what turned your poop brown, essentially. So normally, that when you have pancreatic cancer, that's one thing you pretty much look at daily. I mean, I have since I got diagnosed and all that, and starting going through the treatment. That's what I do a lot. Is I pay attention to my stool. How does it come out? Is it colored? What color is it? And you just pay attention to it a lot more than what you normally would.
When the common bile duct becomes blocked, bile can't reach the intestines and the amount of bilirubin in the body builds up. Cancers that start in the head of the pancreas are near the common bile duct, and these cancers can press on the duct and cause jaundice whilst they're still fairly small, which can sometimes lead to these tumours being found at an early stage.
I wasn't so much early stage. They can't remove it, so yeah, not early. Early is when they can remove it, but they couldn't mine. Anyway.
There are other signs of jaundice as well as the yellowing of the eyes and the skin, and these include things such as dark urine, light coloured or sometimes what is described as greasy stools, as well as itchy skin. However, it's important to remember that pancreatic cancer is not the most common cause of jaundice. Other causes such as gallstones, hepatitis, and other liver and bile duct diseases are much more common. So the second important piece of guidance from the NICE guidelines is that if your patient is aged 60 or over with weight loss and any of diarrhea.
I went from 205, I think when I went in for the thing was 180, and that was a matter of like 2 weeks, if that, when I started noticing it.
Back pain, abdominal pain, nausea, vomiting, constipation, or new onset diabetes.
Diabetes was one that I got too.
You should refer them for a direct urgent access CT scan, or if CT is not available, you can refer them for an ultrasound scan to assess for pancreatic cancer. So if you're watching this video and you've got any concerns, please consult your nearest healthcare provider. I've included lots more useful information links in the description box of this video, and if you've learned something new or you found this content helpful, please remember to give the video a thumbs up, and if you haven't done so already, please subscribe to the channel for new similar content every Wednesday and every Sunday. I hope you enjoyed the video, found it useful.
Let's see if I can go back here. So maybe this duct right here, this green one, that's basically what it was blocking. And what they ended up having to do is they put a stent in there to, open it up to get away from the cancer that was blocking it. And I don't know, just stuff that I'm gonna point out, that if you notice the thing, your pancreas kind of looks like corn, right? Corn on the cob kind of deal. So if you imagine the difference with getting cancer in here versus cancer in the spleen or something else is, you notice the texture area, and it's like corn is an example. It could get down in the grain and all that other stuff, and that's what you have. Like here's your little corn on the cob kind of thing, your pancreas thing, and imagine like how much it would really be hard to tell how far it's spread and whatnot compared to something that's in a solid piece of like say your flesh as an example. I think maybe I'm wrong, but that's just stuff that I'm seeing off of it. But yeah, once I got diagnosed, they with the biopsy, that's pretty much what screwed me up a lot. They stuck a tube down your throat, kind of like a balloon, blow it up, and then they stick a camera down there and something else to get get a chunk of the cancer and send it off so they can test it and so on. That one hurt. So did the stent. I think that really affected me for at least 3 weeks, I think, maybe even longer, and I still was losing weight. And they couldn't start chemo until after the bilirubin count got low enough where basically the yellowness went away. So yeah, fun times, man, fun times. Anyway, that's all I got for today. I can't do too long because I need to get to work and I got some other stuff to do. But I thought I'd share this video with you. Make a video. Like I said, I'm trying to come up with more stuff to talk about and go through it. But hopefully, if somebody's has any kind of symptoms like this, or like I said, it started off with pain right here on the left side, and it's weird because now when I eat, I can tell what foods I eat, if it's too sugary or whatnot, because I'll still get a pain right here. It's like a dull pain. Like I said, when you're running, that's kind of what it feels like. Or after a long run, it feels right there. And then it was a little bit of pain in the back when you're sleeping and so on. And then I went on to the jaundice, the weight loss, tiredness, jaundice, all that stuff. Not fun, man. But I probably have more energy now than what I did then, so that's kind of a cool thing. So anyway, I gotta bounce, gotta get back to work. So I love y'all. Y'all take care, and I'm gonna watch for the next episode to come out.